It's not easy keeping track of all the factors that affect our health. So many things to keep in mind in our lives. Well, one of those factors is kidney conditions, kidney disease. Do you have it? Does someone in your family have it? Are your children safe? So that's where Satellite Healthcare comes in. Satellite Healthcare had a Kidney Action Day in San Jose, and they do it every year at the San Jose Flea Market. This time it was last April 29th, where they helped identify people at risk with free kidney health screenings and blood pressure checks and that kind of thing. And here to talk about kidney disease and what you can do to protect yourself is the Director of Home Dialysis Training and Education, the Home Division for Satellite Healthcare, Joanna Neumann. Nice to have you here.
Thank you for having me.
Well, you're welcome. So how serious is kidney disease in the Bay Area, in America? How big a problem really is it?
It's very serious. In the Bay Area, we actually have 19,617 patients with kidney failure, and then 13,319 depends on dialysis just to stay alive. And we have 6,298 patients live with transplant. So this is a very serious problem, especially in our population. There are a lot of people have high blood pressure and diabetes and might not even aware of it. And high blood pressure and diabetes are the risk factor for kidney failure. And that's why in the Kidney Action Day, we have professionals there to check people's blood pressure and blood sugar to identify those that might have a higher risk factor and not even know about it.
So high blood pressure and diabetes, they don't go hand in hand with kidney disease. They're just warning signs?
Those are the people with diabetes and high blood pressure are at higher risk to have kidney failure or kidney disease. So people have diabetes doesn't mean they have high blood pressure or vice versa. But if a person has diabetes, the chance of the person getting kidney problem is a lot higher, especially if they don't maintain their blood sugar level at a well-maintained level.
And diabetes is more and more common now. Type 2 diabetes, I guess because of obesity, I'm not sure, aging factors, other factors. It's a very common thing now.
Exactly. Obesity is actually a very high risk factor for people to have diabetes. And then also our eating habit and the sedentary lifestyle. People just sit in front of the computer, and instead of going for a walk, now people watch TV on the computer or on the couch. That's really not good.
Was at an event I did annually for the Stroke Association, and a guy came out that we didn't know, wanted to play golf. It was a golf thing. It wasn't a round of golf, but it was a golf clinic for people who've had strokes, right? So we said, sure, we have to take your blood pressure first. And his blood pressure was so high that they took him to the hospital. Mm-hmm. And they didn't let him play golf that day because they were afraid he would have a stroke. So my question to you is, when you have Kidney Action Day, for example, do you find people who have the warning signs that you need to tell them, look, you need to do something soon?
Absolutely. We come across those patients or people, participants, quite a bit. And we tell them, you're really at high risk of getting a stroke. You need to see a doctor. We ask them if they have a primary physician that they can go to. Are they taking any medications for the blood pressure? Some of them say, yeah, I'm seeing a doctor. I have medications, but I just don't take it. So we refer them to the end of the line to talk to a physician or nurse practitioner for much detailed healthcare advices. And people a lot of time they walk around with high blood pressure and not even aware of it. And the thing is, people say, I don't feel bad. Why do I have to take the medication? Or sometimes they will say, if I take the medication, I feel worse, because they're so used to the high blood pressure. Once they take the blood pressure medication, the blood pressure drops and actually become normal, and they don't feel good. It will take a few days or a few weeks before they can feel good again. But they are not aware of that because they might not be monitoring the blood pressure at home. They don't know the warning signal. Or sometimes people with high blood pressure don't feel anything. That's the scary part.
Really?
Mm-hmm.
So if you find somebody with high blood pressure, lowering it, does that lower the risk of kidney disease?
Absolutely. Well-maintained blood pressure at about 120/80 can help to reduce a kidney problem in significant fold.
What are the signs? I mean, we've talked about high blood pressure. So, okay, my uncle's got high blood pressure and he's diabetic, so he's a candidate. It could happen to him. It doesn't mean he's 100% going to have it happen to him, but it means he's likely or more prone to it, right?
That's correct, yes. Having kidney problem, there's 5 stages. People that are at stage 1 or stage 2, they still have significant kidney functions. They might not aware of it unless they go to see a doctor. The doctor do some regular blood work and find that the BUN or creatinine is higher, or GFR, the glomerular filtration rate that measure the kidney function, is lower. Then we know, oh my God, your kidneys have some problem. You're at a stage 1 or stage 2 chronic kidney disease. So we need to monitor you a lot closer, have monthly blood work or quarterly blood work, and then make sure you watch your diet. For patients that have diabetes, we will tell them, you need to keep your blood sugar, for if you're diabetic, for fasting, less than 130, between 80 to 130. If the patient has high blood pressure, we monitor the blood pressure closely also, want to maintain around 120/80. So by maintaining having a good control of blood pressure and blood sugar can help to deteriorate the kidney problem. So we can prevent people from going to stage 1, stage 2, and progress to stage 3 or 4. By the time they're at stage 5, the person will need, we call it kidney replacement therapy, meaning dialysis or transplant.
Is that to hold off kidney replacement? That would be the last resort, right?
That's right. By keeping the person healthy, then we can help to prevent the person from going on dialysis in a layman term.
So I have friends who say, I've got to watch my sugar. I'm pre-diabetic. The doctors say that these days. You're, I guess, a candidate to get diabetes if you're not careful. So say you are pre-diabetic, and you could be diabetic and not even know. So,
exactly.
Okay, you could be diabetic and not know. You could have high blood pressure and not know and think that's normal because you don't check.
That's right.
So what other signs are there that we can look at to protect ourselves?
Okay. For diabetic, the symptoms can be like overthirst, drinking a lot of water, and frequent urination, especially at night, and feeling tired. So it will be good for people to have regular checkup with any physician. And then go back to the Kidney Action Day. We actually provide people, if they don't have means of having medical insurance, there are some clinics that do free checkup. So they can go and get some regular checkup, especially for those that we talk about had come across with finding that they have high blood pressure, high blood sugar, and didn't even know it. We strongly advise them to be followed by a physician on a regular basis and get monitoring.
Then it's up to them. You basically strongly advise them, try and set them on the right path.
Yes, and then we give them the risk factor. We kind of not scare them, but make them aware, you're really at risk. Some people, they say high blood pressure is okay, diabetics is okay, but when we talk about kidney failure, dialysis, they got scared. They say, oh, I don't want dialysis. I say, in that case, you need to have better control of your blood pressure and your blood sugar.
Yeah, also with organ transplants, we've done some interviews about that, and it's often difficult to find a match when you need a match.
Yes, there are a lot of people waiting for transplant. Those that are on dialysis and they are qualified for transplant, they are waiting, and the waiting list is long. Right now in the Bay Area, I think it's about 7 to 8 years minimum. So for the time being, the person will need to be on dialysis unless they find a living-related donor.
That's a lot of suffering.
Yes, it is.
To be on dialysis that long. Are there certain groups more susceptible than others to kidney failure, kidney disease?
Yes, besides the diabetes and high blood pressure that I talk about, for family history, so people that have family that have kidney failure, they are more at risk to have kidney problem, or certain population like African American, Asian American, Hispanic, and Native American. Kind of unfortunate that people with that ethnicity, they are at a higher risk to have kidney problem.
How did you personally follow this path? How did you decide you wanted to help people who had kidney problems? You could have done anything in your field.
I find helping people needing dialysis are very rewarding. Dialysis actually works. People might come in feeling sick, but then once they are on dialysis, they can feel better. Okay, they have to be on a therapy, but they feel better and they can live a relatively normal life with certain restrictions. So, and helping them, making them aware of what they can do to keep themselves healthy is very rewarding. And we can really establish a patient-practitioner's relationship to guide them how to get a better life, to reach their life goals, so that even though despite the fact that they have kidney problem, they can still live a life and have a life goal for them. And, with kidney disease, we have to help them to make a life plan. There are different options to do dialysis: hemodialysis, peritoneal dialysis, transplant, no treatment. They might start with one modality, but down the road, they might have to do other ones. I use an analogy. When a person is young, they want a sports car. And then later on, they have family, have kids, they need an SUV. And then later on, when they get older, they want a more comfortable car. So dialysis journey is about the same. A patient might start with peritoneal dialysis, and then luckily they get transplant. But transplant is not a cure. It's just one of the treatment options. Later on, the transplant might not work. We call it rejection. Patient might have to go back to dialysis. And then they say, I'm getting old. I don't have anybody to help me. Maybe in-center hemodialysis is better for me. So they will have to experience different treatment options throughout the journey having chronic kidney disease.
It's interesting you put it that way. I would look at kidney disease if I had say I was told you have a serious problem, you have kidney disease, you're going to need a transplant eventually. I would look at that as a death sentence, and you call it a life plan.
Yes. Kidney disease is a condition, like diabetes. The person will need treatment when they get to end stage, but it doesn't mean that that's the end of the life. There are different options out there. Yes, when a person has kidney disease and beyond dialysis, they are at risk of death eventually. But if they take care of themselves being on dialysis, they can still live a normal life, especially the patients that are on home therapy. Because they do more frequent dialysis, the treatment resembles the kidney function. They can actually have an active life. We usually guide the patient and then reassure them, we need to find a modality for you that make dialysis fit into your life instead of live for dialysis. There's a big difference. We have patients that still go to work, go traveling, enjoy seeing grandkids, spending time with family.
All of this because years ago, Satellite Healthcare's founder went to bat for home dialysis?
Well, we are the first outpatient dialysis in the Bay Area. Before Congress passed the law, the Medicare law, before 1972, there was a life and death committee that people have to decide who can qualify to do dialysis. But after Medicare agrees, cover dialysis, is more available for people. But it was only being done in the hospital. So our founder, Dr. Norman Copeland, he was one of the physicians at the Stanford Hospital, and he sees that patient has to travel hours from Modesto, from all over the places, just to get the treatment. He say, dialysis shouldn't be so hard for the patient. They're already living with a condition. So he opened up the first outside hospital dialysis. They call it Satellite. Thinking that it's more readily available for the population. And that's how we started satellite dialysis.
That explains Satellite Healthcare.
Yes.
That's fascinating. If I'm listening, I want to protect my family. I want to protect myself. I guess I can watch for signs like a dry mouth or a thirst or that sort of thing. But what would be the steps I should take to protect my family and myself?
Healthy lifestyle for sure. Avoid obesity and exercise. And the Kidney Action Day, we actually have some group of people dancing on the stage and allow people to follow along. And people think, exercise is not that bad. It's fun. Get up from the couch and exercise, and healthy diet. And I would say definitely get a checkup with your physician. Monitor the blood pressure, blood sugar, blood work, because kidney disease might not be able to be tested or identified unless you get a blood test. I always joke about it. Too bad I don't have an X-ray eye to look at the blood and get the digital layout of the blood result. So it's very unfortunate. I have to use the needle to poke the patient to get the blood work. But that's what you have to take.
Joanna Neumann, thanks for talking to us.
Thank you for having us.